Healthcare is freaking expensive in the US, and it is chronically ill families like mine that are feeling the brunt of this expense because we spend 5 times more every single year versus our healthy neighbors. Thanks, Jamie. Great job, Margaret. Hi, I'm Jeff McCormack, the co-founder and CEO at Iryss. In 2008, I was diagnosed with multiple sclerosis. And despite my deep experience in both healthcare and finance, I struggle immensely with financial anxiety as a result of my diagnosis. Because healthcare is freaking expensive in the US. And it is chronically ill families like mine that are feeling the brunt of this expense because we spend 5 times more every single year versus our healthy neighbors. And this creates a tremendous amount of fear. In fact, 92% of chronically ill patients live in financial fear. At Iryss, we are committed to helping those 130 million Americans eliminate fear, the financial fear from their diagnosis. There are solutions that have been launched to help people and families like mine. The problem is they're extraordinarily difficult to find, and I don't know whether they're right for me in my situation. So at Iryss, we've built an expert system that does 2 things for our users. The first thing is we guide users to platforms and services that can save them a significant amount of money. The second thing we do is we build a personalized payment plan that ensures payments of medical bills are in that user's best interests. Let me take you through a quick example. It's one of my favorites. Sarah, unfortunately, was diagnosed with breast cancer last year at the age of 37. And she's a single mother of 2 young boys. She was spending $600 per month in out-of-pocket medical costs. Iryss's personalized recommendations were able to eliminate Sarah's go-forward spend by 90% and reduce over $2,400 in previous bills that she had incurred and had not yet paid. It is experiences like Sarah's that led us to be accepted into batch 14 of Plug and Play's InsurTech program, which we just graduated in June, but also for CIO Review to recognize us as one of the most promising data analytics services providers in 2023. We've initially launched Iryss through the employee benefits channel because employees and employers are struggling with the migration of employees to high deductible health plans and the increased financial burden that comes with paying for first dollar coverage of healthcare services. By in no way, shape, or form do we view employee benefits as the only distribution model, but it's the one that we have attacked first, where we see the fewest challenges and the quickest sales cycle. Besides myself, I have an extraordinary Chief Technology Officer, Tuan, who comes to us via a successful exit in 2017 in the health tech space. Tuan's superpower is his ability to take my fairly incoherent requirements and translate those as executable sprints to our Vietnamese development team. We're nearing the end of our $800,000 pre-seed range. We have about $250,000 remaining, and we're looking for mission-aligned partners that are interested in helping us transform the lives of chronically ill patients. So please connect with me on LinkedIn using the QR code, or give me a call or give me an email. I'd love to talk to you. Thank you.
Jeff, great presentation. I know this is something that is, near and dear to my heart when I take a look at what's happening in our healthcare system today, right? Healthcare is the #1 cause of bankruptcy. Could you go into a little bit how medical bills play into that, and what you're really, where is the break point where a medical bill becomes a problem for a family that they can no longer solve on their own without assistance?
Yeah, so I'm going to start with your second question first and then go back to your first question. So a $500 medical bill really starts the tailspin for the average American. The average American does not have $250 in the bank account as savings. So you're talking about credit, right? Either charging it, which is the worst, because now you got 25% APR on that, on top of what you already have on your credit already. But that starts the snowball in motion, right? And if it's a chronic condition, which is the area that Iryss is focused on, we're not talking about one interaction with the healthcare system annually. We're talking about, on average, 8 interactions with the healthcare system. So the bills just add up and add up and add up, and that leads to the cascade that ultimately ends up in bankruptcy. And we're looking to eliminate that.
So one of the questions from the audience from Stephen is, how does this work with the Medicaid population, if at all?
Yeah, so we are not currently going after the Medicaid population. We're going after employer-sponsored health plans. But I understand the question because I sit on the board of a nonprofit that primarily serves developmentally disabled children, and so a large Medicaid population. I could see Iryss in that venue in the future, where we help families understand the benefits, because there's a lot of self-pay that's now occurring with Medicaid, and the coordination of care that occurs there. We could ultimately help that population, but today, not our focus.
So product roadmap, but today focusing on a different market. Tell us about your customer traction. Where do you currently sit in terms of really getting your solution out to market?
Yeah, I really appreciate that question. So we launched our product, we'll call it our beta product, in June. We onboarded our first enterprise customer in July. We have 3 other agreements signed with enterprise clients that will launch in September and October. But most exciting for us here, as we sit here today, we have a verbal agreement with a 40,000 member cancer community with a planned launch of November. For that partnership agreement. That's a rev share agreement. And we're going to be launching as part of their cancer conference, which has 50,000 attendees.
When we take a look at what you're doing and the market that you're currently looking at, you're looking at this employer market, which is obviously a very big market. But a lot of these employers have people who are administering, if they're self-insured, they have people administering their plans, or they're working with a brokerage or something like that to take care of their benefits. Why do they care about this part of the value stream? Why do they care about your solution?
Yeah, so ask an HR professional and they'll tell you why they care, because the people that are impacted, the people that we're helping, are the frequent flyers in the HR department. They're calling them on the phone, they're emailing them. Frankly, they're berating them about the situation of the health plan. So to have any solution that can help those individuals is like a godsend. And that word has been used with our initial client because we have great utilization statistics with our first client. And the volume of calls that they're receiving about concerns about the health plan have gone down even in our first month and a half after launch. So we're super excited about that.
Jeff, do you have case studies on how, dollars saved per patient or things of that nature that you're discussing in market right now?
We do. So, it's still early in terms of our enterprise launch, but the average user is adding 1.4 medical bills. And right now we are saving 82% of people's medical bills for the one that we've launched. Prior to that, we ran a concierge MVP service. We were able to identify savings for about 60% of users that came in through the concierge MVP. Average savings was $600, a little over 25% of their total bills.